Today we are talking about meningitis. There's been an outbreak of meningitis in some parts of the UK. We want to find out what meningitis is, what causes it, some of the symptoms, how meningitis is treated, and some preventive measures. So the first question we want to answer is, what is meningitis? What is meningitis? Meningitis is an inflammation of the tissues that surround the brain and spinal cord. It is an inflammation of the tissues that surround the brain and spinal cord. Meningitis can be life-threatening, so it's appropriate that we all know some of the causes of meningitis, how to treat it, and how to prevent meningitis. So, what causes meningitis? There are various forms of meningitis. You can get viral meningitis when it is caused by a virus. There's bacterial meningitis as well when meningitis is caused by a bacteria. You can get drug-induced meningitis. That is when meningitis is caused by a drug that you take. For example, non-steroidal anti-inflammatory drugs can cause meningitis, and some other medications as well. And you can get meningitis when your immune system is compromised as well. There are some immune conditions like lupus that can cause meningitis. Meningitis can also occur when you have cancer, and that is known as carcinoma meningitis. That is when the cancer cells invade the tissues surrounding the brain and spinal cord. You can get meningitis from that. So, what can make you get this infection? You can get meningitis from contact with a bacteria that is passed on from person to person. You can also get meningitis from food that is contaminated with an infection, or food that is contaminated with a bacteria or a virus. You can also get meningitis from the environment. The environment contains a lot of fungi that we breathe in. The environment contains a lot of bacteria, and when you breathe these in or touch them and get them into your body, you can develop meningitis from that. You can also get meningitis from an injury or a complication of a brain surgery can also lead to you developing meningitis. And as I said earlier on, a side effect of a medication, for example, a non-steroidal anti-inflammatory drug examples are ibuprofen, naproxen, and diclofenac. These can also cause meningitis. Of course, this will not happen to anyone at all who takes these medication. But if your system allows it, you can develop meningitis as a result of a side effect of these medication. So we all need to take note of this. What are the symptoms of meningitis? Meningitis presents with different symptoms in different people, and for adults, the symptoms may be different from a child who develops meningitis. Some of the symptoms of meningitis in adults include fever, a stiff neck, sensitivity to light, a headache, nausea and vomiting. A headache that comes on suddenly, which you need to be aware. For instance, you are there and you just develop a headache out of nowhere. You're not stressed. You've not done anything to your body, but all of a sudden you develop a headache. You can develop meningitis. It could be that it's meningitis. Meningitis can also cause confusion and altered mental status. It can bring about a lack of energy. It can cause extreme sleepiness and trouble waking up. Hello, Anita Sonka. Hello, Helen. Tinuka, Lisa, thank you all for joining. I'm talking from the UK. Thank you all for joining in. I'm really grateful that you are all here. Meningitis can also cause low energy and slower responses. Of course, there are other medical conditions that can cause these symptoms, but it's best to get yourself checked. When you start developing some of these symptoms out of nowhere, for example, you start developing a sudden headache, as I said earlier on, you feel feverish, you're vomiting, and the vomiting is associated with sleepiness as well as low energy. There's a need to get yourself checked. Meningitis can be treated, and when it is caught early, if it is a bacterial meningitis, it will be treated with antibiotics. If it is a fungal meningitis, it will be treated with an antifungal. And if it is a viral meningitis, you will be given an antiviral medication to take. If meningitis is caused by a drug, for example, a drug-induced meningitis, that is how it is called, the drug would have to be identified and you will be made to stop taking that drug. So meningitis can be treated. Don't wait. It can cause complications. And as I said, it is life-threatening if it is not caught early and if it is not treated on time. It can lead to some complications that can be irreversible. So meningitis can be treated. Get yourself checked as soon as possible once you develop the symptoms so you can get better. So now let's talk about some preventive measures. We all don't want to fall ill. We all don't want to develop any infection on our body because infections can make you very uncomfortable and they can make you ill. So as much as possible, we want to prevent ourselves from catching an infection and falling ill. There are preventive measures that we can all take to prevent ourselves from developing an infection. And the first one is to get vaccinated when it comes to meningitis. There's a vaccine that you can take to prevent yourself from getting meningitis. Ask your healthcare provider and they will be able to help you out. The second thing is to wash our hands regularly. I can't emphasize this enough. Wash your hands as often as possible. Most infections that we develop come from things that we ingest through our mouth into our bodies. And the things that we ingest through our mouth into our bodies come from our hands because we don't wash our hands. We need to regularly wash our hands. You touch something, you wash your hands afterwards. You finish doing something, you wash your hands afterwards. There are so many people who don't wash their hands, and you won't understand the reason why. It's very essential that we all develop the habit of washing our hands regularly. If you don't have access to water, you can use a hand sanitizer, which would be available like around you. Especially if you are at work, you finish using the washroom, you need to wash your hands. We need to wash our hands regularly. It is very important because there are so many microorganisms around that we don't see. And if you don't see the microorganism, it doesn't mean that it is not there. It is there. You need to wash your hands regularly. And the third thing is avoid contact with people who are very ill. When someone is very ill, there's no need to get close to the person. If it is a visit that you have to make to someone who is ill, it's better to avoid doing it till the person gets better so you don't contract any infection from that person. Also, avoid contact with people who are coughing, who are sneezing, and disinfect frequently when you touch any surface. Avoid swimming or drinking water that is contaminated or not treated. And also practice safe food preparation. When you're preparing your food, it's better to do it in a safe environment. Clean your surfaces before you start preparing food. And make sure your food is warm enough before you eat it, especially if it's coming from the fridge. Make sure you warm it before you eat it. And also take precautions to avoid bites from insects, mosquitoes, and so on. When your water is not distilled, don't drink it. If water is dirty, don't drink it. And make sure when you're drinking milk, it's also pasteurized. Avoid drinking unpasteurized milk. Now, we've talked about meningitis, how it is spread and how it is prevented and the causes. So I'm sure now we've all updated our knowledge on meningitis. Like I said earlier on, there's an outbreak of meningitis in some parts of the UK. So we all need to be aware of this and take all the necessary measures to prevent ourselves from developing this infection. I hope this short video is helpful. I can see you, Williams Brothers. Thank you so much for joining. You have asthma. Yeah, asthma is a respiratory condition. One day I would come up here and talk about asthma so we can all learn about asthma. Thank you all so much for joining in. I'm happy to see you, Anita, Helen, Tinuka, Lisa, and Williams Brothers. Thank you all so much for joining in. And I hope to see you soon in my next one. Thank you so much and see you. Bye. Take care. Have a lovely weekend, you all. Bye-bye.